Apomorphine, sold under the brand name Kynmobi, is a medication used to treat OFF episodes in people with Parkinson's disease. These OFF episodes refer to periods when the usual medications are not working well, and symptoms such as tremors, stiffness, and difficulty moving return. Apomorphine can help improve the ability to move during these OFF periods by restoring the balance of dopamine in the brain. It comes in sublingual film form in various strengths, including 10 mg, 15 mg, 20 mg, 25 mg, and 30 mg. The dosage and timing of Kynmobi should be individualized based on the patient's needs and response to the medication. It is important to follow your healthcare provider's instructions regarding the daily dosage and the best time to take this medication for optimal effect. Before you start using Kynmobi, be sure to read the patient information leaflet and instructions for use provided by your pharmacist. If you have any questions, don't hesitate to ask your doctor or pharmacist. When using this medication, make sure to moisten your mouth with water before placing the film under your tongue. It's important to keep the film in place until it completely dissolves, which usually takes about 3 minutes. Avoid talking, swallowing, chewing, or moving the film while it's dissolving to ensure it works effectively. The dosage of Kynmobi is based on your medical condition and how you respond to treatment. Your doctor may start you on a low dose and gradually increase it to reduce the risk of side effects. It's important to follow your doctor's instructions carefully and not to take more than 5 doses per day, with at least 2 hours between each dose. If you experience nausea while taking Kynmobi, your doctor may prescribe another medication to help prevent or treat it. It's also important to note that suddenly stopping Kynmobi can lead to withdrawal symptoms, so your doctor may gradually lower your dose to prevent this. If you find that your condition is not improving or is getting worse while taking Kynmobi, be sure to inform your doctor. It's important to communicate any concerns or changes in your condition to your healthcare provider. Some common side effects of Kynmobi may include nausea, vomiting, mouth pain/sores/numbness, gum swelling, dry mouth, headache, dizziness, drowsiness, tiredness, or runny nose. These effects may lessen over time, but if they persist or worsen, it's important to contact your doctor. This medication may cause a drop in blood pressure, especially when starting or increasing the dose, which can increase the risk of dizziness and lightheadedness. It's important to get up slowly when rising from a sitting or lying position to minimize this risk. Remember that the benefits of taking this medication have been determined to outweigh the potential risks for you, but it's important to contact your doctor if you experience any serious side effects such as mental/mood changes, unusual strong urges, unusual tiredness, pale skin, fast/irregular heartbeat, severe dizziness, fainting, or a painful or prolonged erection lasting 4 or more hours. Additionally, if you experience increased sleepiness or fall asleep during the day, you should avoid driving or participating in other potentially dangerous activities until you have discussed this effect with your doctor. A serious allergic reaction to this drug is rare, but it's important to seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, and if you notice any other effects not listed above, you should contact your doctor or pharmacist. If you have any concerns about the side effects of this medication, it's important to discuss them with your doctor. Before starting treatment with Kynmobi sublingual film, it's important to let your doctor know if you have any allergies or if you have a history of certain medical conditions. This medication may contain inactive ingredients that can cause allergic reactions, so it's essential to discuss this with your pharmacist. Kynmobi may also affect the heart rhythm, so it's important to inform your doctor about any heart conditions or if you're taking any other medications that may affect the heart rhythm. It's also important to discuss any history of low levels of potassium or magnesium in the blood, as this may increase the risk of heart rhythm issues. This medication may cause dizziness or drowsiness, so it's important to avoid activities that require alertness until you know how this medication affects you. It's also important to avoid alcohol or marijuana while taking Kynmobi, as these substances can increase dizziness and drowsiness. Older adults may be at greater risk for certain side effects of Kynmobi, such as falls or hallucinations. If you are pregnant or breastfeeding, it's important to discuss the risks and benefits of using this medication with your doctor before starting treatment. When taking Kynmobi, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist, including prescription and non-prescription drugs, as well as herbal products. Do not make any changes to your medication dosage without consulting your doctor. Some products that may interact with Kynmobi include certain drugs for nausea, opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, and antihistamines. It's important to inform your doctor or pharmacist if you are using any of these products. Additionally, be sure to check the labels on all your medicines, such as allergy or cough and cold products, as they may contain ingredients that cause drowsiness. If you have any concerns, ask your pharmacist about using these products safely. Always follow the guidance of your healthcare provider when taking Kynmobi. If someone has taken too much Kynmobi and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. Remember, it's important not to share Kynmobi with anyone else. This medication is prescribed specifically for you and should not be used by anyone else. Kynmobi is a sublingual film that contains the active ingredient apomorphine, which is a dopamine agonist. It is used as an add-on treatment for people with Parkinson's disease who are experiencing off episodes. These are times when their symptoms are not well controlled by their current medication. Kynmobi is used to help improve mobility and reduce the time spent in the off state. The dose of Kynmobi will be individualized for each patient. The starting dose is usually 10 mg, which may be increased as needed up to a maximum dose of 30 mg. The film is placed under the tongue, where it dissolves and is absorbed into the bloodstream. It is important to follow the instructions for use provided by your healthcare provider. Kynmobi should be taken as needed, but not more than 5 times per day. It is important to wait at least 2 hours between doses. The effects of Kynmobi are usually felt within 30 minutes, so it may be taken shortly before or during an off episode to help improve symptoms. It is important to talk to your healthcare provider about the best timing for taking Kynmobi based on your individual needs. When storing Kynmobi sublingual film, make sure to keep it at room temperature and away from light and moisture. Avoid storing it in the bathroom and keep it out of reach of children and pets. When it is expired or no longer needed, be sure to properly discard the product. You can consult your pharmacist or local waste disposal company for guidance on how to do so responsibly. And remember, do not flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.